Hello, everyone. Today we'll be talking about our clinical case study from a multidisciplinary treatment approach. Our group members consist of myself, Caitlin Davies, Avery McDonald, and Sydney Anderson. So just an overview of what we will be talking about. First, we'll be talking about our client profile and about our client. And then we'll be talking about treatment approach number 1, which is occupational therapy. Treatment option number 2, which is cognitive behavioral therapy. Treatment option number 3, speech and language therapy. Treatment number 4, physiotherapy. And lastly, our alternative treatment option, which is humanistic therapy. So first, we'll be talking about our patient, and this will include his diagnosis, his symptoms, signs, and treatment goals. So James is a 49-year-old male who has just been released from prison. He is presently living in a group home and is unemployed. James wants to find gainful employment, but due to his diagnosis of severe obsessive compulsive disorder, OCD, he finds it quite difficult. As a result of his fear to leave his room and interact with others, he eats quite unhealthily. James also has a significant issue with stuttering, which makes verbal communication quite embarrassing for him. Therefore, James has the following goals: get meaningful employment, eat healthier, reduce his OCD symptoms, manage his stuttering, and avoid jail again. So this is our intervention plan outline. These are the 4 therapy options that we have selected for James' case based on the history and diagnosis already provided. As always, confidentiality will be discussed prior to any treatment, as well as ensuring that the client, in this case James, completely understands his rights to treatment and boundaries/limitations. As well as a brief history will be gathered regarding his biopsychosocial plus influences that have in the past and will continue to have an influence on his treatment progress, as well as a more developed sense of his diagnoses to have a clearer picture of who James is from a client-centered point of view and formulate a treatment program involving the following options. The 4 selected treatment options that we have chosen based on James' goals are occupational therapy, in order to assist him in finding employment, leisure, volunteer opportunities, and also to aid him in setting goals. Cognitive behavioral therapy, to help manage his negative thoughts and learn alternative approaches to his circumstantial anger. Speech and language therapy, in order to help manage his anxiety about social interactions and public embarrassment. And lastly, physiotherapy, in order to help him gain awareness of his body, improve confidence, and reduce psychiatric OCD behaviors.
The first treatment approach I'm going to discuss is occupational therapy. Occupational therapy can be defined as a type of healthcare that assists with solving problems that can interfere with a person's ability to do the things that are of importance to them. As we look at James's case, it is quite recognizable that he is really struggling with doing daily activities like getting out of bed, showering, eating healthy, and attending his appointments consistently. Occupational therapy can benefit James in a multitude of ways, and we can hope that an occupational therapist can assist with finding work based on James' interests near his living arrangements. This would assist with him getting out of the house in the future, although work in the future is a bit far away. There are other small steps that need to be dealt with before work becomes an option, as James is currently struggling getting out of his house. Occupational therapists can assist with self-care and assuring that James is taking part in his mandatory appointments, helping him build a meal plan for him to start eating healthier, assuring he's getting dressed and changing his clothes, as well as slowly exposing him to the outside world. Structure in general is important for James to reinforce positive behaviors he is engaging in, and to understand how his negative behaviors could most importantly end him back in jail. Structure could include meal times, dressing times, and set therapy times. This will also allow him to implement, practice, and be taught coping skills to adjust to a new environment after being in jail for a while and adapt to living with other people. The second treatment approach is cognitive behavioral therapy. As mentioned, James is diagnosed with OCD, which is obsessive compulsive disorder. Working alongside a therapist who can implement cognitive behavioral therapy skills and interventions will assist James on his current fears and beliefs about the outside world, which he fears so deeply, and can also assist with his compulsions and how to handle the intensity of them. James's fear of other people may come down, to a fear of judgment, fear of germs, and providing an understanding on these beliefs in depth may give him answers towards the compulsions he experiences. So, for example, exposure therapy specifically may help James adapt and adjust to the outer environment better so he can eventually attend work and meet the goals he desperately wants to do.
For treatment approach number 3, we have speech and language therapy. So speech and language therapy for adults such as James is more so to help better manage his stuttering. So an SLP will help him feel less tense and speak more freely in school, at work, and in a multitude of different social settings. It would also help James with face-to-face speaking, making certain social situations less fearful or reducing anxiety. This might include speaking on the phone or ordering food at a restaurant. An SLP will also discuss with James how his stuttering is affecting his everyday life and better come up with a treatment method that best suits his specific situation. And this type of therapy specifically will be very useful for James since he has clearly stated that the stuttering in his speech has caused him embarrassment, and it also partially the reason for his path towards criminality, because his first offense was assault against somebody who was making fun of his stutter. Lastly, we have physiotherapy. So physiotherapy, also known as physiotherapy, can be performed in a multitude of ways, such as yoga, dancing, weightlifting, and just having that physical activity in your life is said to have antidepressant effects and help improve mental and physical quality of life while reducing psychiatric symptoms. So this would help James specifically because of his OCD. Through physiotherapy, he could help reduce the symptoms of his OCD. And he has also stated that he wants to eat healthier, and through a healthier diet and physical activity, it could help create more positive body awareness towards himself and help him gain more confidence, but could also help encourage him to leave his house more often and get out and achieve the goals that he is trying to achieve.
And lastly, we have selected an alternative treatment, which is humanistic therapy. So based on the description of humanistic therapy and how it relates to positive psychology and Abraham Maslow's hierarchy of needs, it will help James become more focused on being his true self and believing that though people may make mistakes like he has in his life, he should still hold himself and others in high regard in order to reach his full potential. Although helping James better understand his view of the world and how his thoughts impact his daily life could be useful and insightful at the time, it may not particularly be helpful long term in this situation, as he seems to be seeking therapy for specific behavior assistance and goals rather than self-acceptance overall, which is the basis of humanistic therapy. And these are our references. And thank you everybody for listening. We hope you enjoyed our presentation.